In this video, we will talk about cardiopulmonary resuscitation, better known as RCP. So, we will perform our emergency plan. First step, check the place it may be safe for the affected person and me. Second step, call ambulance 131. And the third step, assist to the affected person. We learned that RCP has various types of learning for neonatal, pediatric, and adult patients. An importance of implementing RCP in the first minute after passing the accident is vital, because every minute wasted, people lose 10% of the heart if we don't take appropriate action.
So what step we must take into account before resuscitate? 1. No response. 2. Don't breathe. 3. No pulse. If we have an AED automatic defibrillator, we need to use immediately and leave aside RCP maneuver. Why do we must activate the first emergency plan and not determine the pulse? Because if there is no response and no breathing, there is no so much time to assist. That we know all the steps to consider, we will apply maneuver. 1. See if the patient is not responding, no breathing, and has no pulse. 2. If we are alone before applying to maneuver, we should call 131. In case the other person near us, we must ask him or her to call 131 and inform to me instruction that he or she is receiving. In that way, the person will feel at the compromise with the situation. 3. Let's imagine a middle line on the chest of the patient body and another line passing through the rib. 4. Where the line meets, superpose their hands and start chest compression strongly. 5. We must do 13 compression and 2 artificial ventilation during 5 cycles. 6. After making the 5 cycles, we see the state of the patient and start with the 3 steps that we mentioned a while ago: respond, breathe, and pulse. 7. It's very important to bring the count of cycles so that when the ambulance arrives, tell paramedic in which part you are with the producer in order they can follow the producer or my other person near to patient can count the cycles. 8. If you don't have anything for making artificial ventilation or you don't want to, you can handle the technique of the American Heart Association only hands.
9. You must perform 100 compressions per minute without interruption. 10. Remember that if to do the maneuver only hands, you must make at least 5 cycles. 11. Each cycle has a duration of 2 minutes equivalent to 200 compressions. That is what we must not do. 1. When we do the artificial ventilation, we should don't such a deep blow because the oxygen can get straight to the stomach and not the lungs. 2. We should not make the ventilation between the nose and mouth. We just cover the nose with your fingers and your lips must stay with the patient's lips. 3. The patient's neck should not be attached to the chest before starting resuscitation. Should leave the neck straightened. To end this presentation, we have some tips for you to perform this maneuver and to follow the battery of The Song Still Alive by Bee Gees or Macarena by Bayside Boys.